Alright, so I did want to make this video for those of you who are curious about the drains, curious about what things kind of look like post-surgery. Sorry, the lighting in my bathroom is really bad. So for those of you who are squeamish or do not want to see kind of what is underneath the shirt in terms of like where they left me with surgery, again, please turn off the video right now. There will be graphic content. You will see blood. And also other fluids and stuff. So it looks gruesome. So if you don't want to see it, turn off now. I'll give you time to do that. For those of you who are looking at this from an educational perspective, I'm happy to share my experience and kind of what I do a couple times a day in terms of maintaining my drains. All right, so I assume those of you who don't want to see this have already turned this off. For those of you who do, thanks for watching. So I don't, again, have a good place for my phone. Yeah, I guess this could work. All right, I'll do my best. Bear with me. So I had to run out and get my notebook too. So again, a couple times a day, I just record the measurements of my drains as well. So we'll keep this here. So again, I have to drain, and I just woke up this morning. I gotta take care of my drains. This is what I do. So the doctors gave me, again, I think I mentioned this in another video, this amazing, very soft and comfortable shirt. And it actually has pockets on the inside so you can put your drains in them on both sides, which is great. My mom was also super awesome and got me this little, kind of, I've called it like a carpenter belt, but it's just like this little fanny pack where I can stick the drains in as well. I utilize both. When I sleep, I like the fanny pack a little bit better because it keeps the drains like kind of on top of my belly when I sleep on my back. I don't have to worry about rolling over onto any of the drains or them spilling or leaking. So this is kind of what I look like post-operation. They gave me, can you guys see this okay? All right, so they gave me this surgical bra that kind of goes all the way around and kind of holds and compresses everything. And then I also have 3 drains. So I have a drain on each side for where they did the surgery, plus a drain up here, a third drain for my lymph nodes. So I have 3 drains, and yeah, they're okay. You can, I'm not going to get too graphic here, but they're literally just inside, and they come out with blood and liquid. I'm not going to take off my surgical bra to show you the actual scars because I'm still healing. Again, this is only day 4, and I have a meeting next week with my doctor, so at that point we're going to probably look at the sutures and kind of see where everything's at that point. But I think this is graphic enough for my first video. So the doctors also gave me, let's see, these little containers. So what I do, container 1, container 2, and container 3. So I just open them all up. And I went to CVS and got all these awesome alcohol strips. Actually, I should say my mom went to CVS for me and got all these alcohol pads. So I just do 1 drain at a time. The nurses at the hospital were nice enough to number my drains. So, sorry, I'm very swollen here. So this is drain 1. This is what they look like. And I take just 1 drain out at a time, get an alcohol pad. And what they suggest is you milk the drain. So I hold on to it up here and just take the alcohol strip and slowly push the fluid through the drain. Sometimes it gets a little twisted. And I am using a lot of tension, so I'm holding on to it really tight. So first of all, I'm not feeling any pulling or tugging from the actual site. I'm holding on to it very tightly here. And then with my other hand, just pushing the fluid into the drain. This is helpful because sometimes you'll get like pieces of blood and stuff that are pretty thick and can't get through the drain themselves. So creating this section, the suction actually really helps move the fluid along. So I do that, and this one actually looks pretty good. I might do it again just to make sure I'm getting the most liquid out of there as possible. Again, I just woke up, so there should be a good amount of fluid here. All right, and then I just unplug it. This one's taped because it tends to leak a little bit on me. But I just untape it. it expands like a little grenade. And then I get into my cup number 1 and just drain out any liquid that was in the drain. So the way these drains work is by like suction. So once you take out all of the liquid, you can just squeeze it really tightly. Sometimes you can roll it up really tightly. I take my alcohol tab again and just kind of clean the top of it just to make sure no germs are getting into it. Close it, and now it's like a little suction cup. And so this suction will actually pull the fluid from inside of me and get it into here. So I do this a couple times a day. So that was drain 1. It's important when you look at your drain, there's not a lot of liquid in here, which is great. 3 days ago, there was a lot in here, and it was also more of a red color. So you're eventually going to see the amount of liquid being drained decrease and the color go from like a red color to almost a yellow and clear color. So I'm going to say this is kind of like an amber, and just looking at it, it looks like it's about 10 cc's. So on my chart, I'm just going to record the time. So today is, let's see, 4:11. The time. Drain 1, drain 2, drain 3. So the time is 8:15 a.m. and drain 1 was 10. So that's an example of what I do, and I just repeat that 3 times. So looking at, we're going to do drain 3 next because this is the one connected to the lymph node. This one, you can tell right away, has a lot more liquid in it. So again, I take my alcohol strip, I make sure I hold on to it very tightly because I don't want to pull the drain out. That would be quite painful. And I just milk the drain and pull any excess fluid that I can into the drain. So just holding on to it. Yeah, they call this milking the drain. I've never done this before, obviously. I have a home nurse coming to visit me today as well, so I'm going to ask her. If you can see, I get these little like blood clot thingies in the drain. And you can kind of see up here, there's a lot of red that's stuck up here and it's not actually quite getting down into here. So again, when the nurse comes today, I'm going to ask her about that because I'm not sure if that's normal or not. So again, things just to kind of keep in mind when you do this every day, a couple times a day, you'll start to notice some changes. And if anything seems abnormal, just ask your doctor about it. So again, drain 3, and I'm showing you this one just as a comparison. So in the first one, it was only 10 cc's about, and this one I know I'm going to have a lot more fluid coming out. So again, you just drain it, you squeeze it to kind of make the suction. I'm going to clean off the tops. And then we start the process all over again. I'm going to stick it back in my pouch. Alright, so this one, just in comparison, I would say is at 30 cc's. You can just tell right away there's a lot more fluid in there. So I'm just going to record drain 3 at 30 in amber. It's important to record also the color. So when I do meet with my doctors in the follow-up, I can show them this long list of just kind of date, time, and recordings of the fluid that's coming out, so that way they can see the progress being made. So I hear the magic number is 30 cc. So at the end of the day, I do this a couple times a day, and at the end of the day I add up all the totals. And when one of the drains actually drains less than 30 cc's in the entire day, that's a really good sign and can indicate to the doctor that I'm ready to have that drain removed. So I don't think I'm there quite yet, but hopefully by the end of the week, some of these drains on either side of me, maybe not necessarily the lymph node because I'm still getting a lot of fluid,